The health professionals told us that they want kind of written resources and content that they can provide to parents, or that can support those consultations. And I suspect that some of that's about giving them the confidence that they have the capacity to actually answer the parents' questions and give them kind of sound evidence-based answers. So we've written a series of 5 fact sheets that answer the kind of top 5 questions that parents have according to the surveys we've done in Australia. And also some other resources like a discussion guide that helps providers to facilitate a conversation that enables the parents to clarify what their concerns actually are and how their kind of proposed course of action fits with their own value system. As well as those, there's a training workshop that's still in development, and a discussion guide that is almost like a memory jogger for providers to help them to kind of maintain the structure of their consultations so they don't get out of hand or kind of descend into an adversarial kind of encounter, which, you know, both providers and parents find to be unhelpful. So the 5 fact sheets are actually have been published and are in use, and whenever we show people those, they're both parents and providers, they get really excited about them. And we think that's because they have some of the values of the SKY system embedded in them. So they approach the questions as reasonable and valid questions. They engage with the parent in the way that they're written, in a kind of interpersonal way. They use, you know, linguistic techniques like active voice and question-answer format rather than kind of repeating a myth. And so they have been received really well. The rest of the system, which is some consent information, the kind of decision support tool, the discussion guides, some anticipatory guidance around what happens after a vaccination or if a child's not fully vaccinated, we will be testing in the next few months in a variety of clinic types in Australia for feasibility. And then hopefully, if we get a grant, we will be able to test those for efficacy at a later date.